Hello, my name is Trina Rose Cerrizo Fox, and today I'll be performing the skill video of prenatal education for a healthy pregnancy. I'll start off with a room scan. And I'm just using that container to hold my phone up. And then here's the ceiling. Okay, I would start by entering my patient's room, closing the door for patient privacy, performing hand hygiene, and introducing myself to the patient. The first category we'll be discussing is prenatal care. First of all, the frequency of visits. For your first trimester, which is up to 28 weeks, you'll have your appointments monthly. From 28 weeks through 36 weeks, you'll have your appointments every 2 weeks. And then from 36 weeks till birth, you'll have your appointments weekly. Some things to expect at your first appointment. We'll obtain your health history, family history, risk assessment, physical assessment, medication review, pap smear, vital signs, labs, ultrasound, urinalysis, and we'll go over your due date. Some things to expect at your follow-up appointments are going to be your blood pressure, BMI, fundal height, fetal heart tones, and assessing fetal growth. And then some tests to expect at your first visit. It's going to be your hemoglobin and hematocrit, and that's to detect if you have anemia. Next would be your blood type and RhRBC antibody screen. That's to detect if you have RhD negative blood, in which case we would administer the appropriate treatment. Next is urinalysis. That's to detect if you have any renal disease, infection, or hypertensive disease. And fourth, we would do your blood glucose. That would determine that would identify if you could have gestational diabetes. And next category is proper nutrition. You'll want to ensure for your nutrition that you are eating fully cooked proteins, food that is high in iron, fruits and vegetables, about 2 to 3 cups of those per day, whole grains, and low-fat dairy. Some vitamins and supplements you want to ensure that you are receiving are going to be folic acid, iron, omega-3 fatty acids, calcium, and vitamin D. Next category, we're going to discuss exercise. You want to ensure that you are doing about 150 minutes of exercise per week, and this should be moderate intensity aerobic activity. Some examples of what you can do are going to be walk, swim, cycle, stretch, yoga, things that are more low impact. Things that you should avoid are going to be contact sports, scuba diving, or even sports that require you to hold your breath. And then that was exercise. Next, we will talk about appropriate weight gain during pregnancy. You are considered underweight if your BMI is less than 18.5. In that case, you should be gaining about 28 to 40 pounds during your pregnancy. If you are of normal BMI, that is between 18.5 and 24.9. In that case, you should gain 25 to 35 pounds during your pregnancy. You are overweight if your BMI is between 25 and 29.9. In that case, you should gain about 15 to 25 pounds during pregnancy. And lastly, obese, your BMI is 30 or higher, and in that case, you should gain 11 to 20 pounds during your pregnancy. Next category are going to be common complaints during pregnancy. First one is nausea and vomiting. And to help prevent this, you should make sure you never have an empty stomach or an overloaded stomach. Next one is going to be constipation. To help with this, make sure you're eating high fiber meals and drinking 8 to 10 glasses of water a day. And also heartburn. To help prevent or avoid heartburn, you want to make sure you are limiting your fatty foods and avoiding large meals. Our last category to discuss are warning signs in which you'll want to notify your provider ASAP. First one would be abdominal pain, severe abdominal pain and vaginal bleeding, as this could mean an ectopic pregnancy or miscarriage. Second one, severe headache, as this could mean hypertensive conditions or preeclampsia. And lastly, back pain or flank pain, as this could mean kidney stones, kidney infection, or preterm labor. Thank you.